Hello, everyone. This is Michael Misko with Cairo Secure's Growth Without Risk weekly presentation. And I have to apologize. I'm on the road this week in trial. So I'm doing this from my hotel room. And hopefully, uh, you all can hear and see me well enough. But this week, we're going to take a question from the trenches. Occasionally, I get emails from Cairo Secure insureds with some questions, and I thought this was a good one because I've been doing a lot of cases with respect to massage therapy. So, this particular member says, I'm a 20-year chiropractor, Cairo Secure member, recently took a part time position in a massage therapy focused center as an independent contractor where the massage therapists are employees to the center. None of the therapists nor the center has an NPI number, which means they would like to use me for the billing. I have a few questions. Okay, so immediately my antenna are up because they are looking at this doctor as a billing vehicle in order to get third party reimbursement for what are no doubt um, massage therapy services in the comfort realm. I like to call them head, shoulders, knees, and toes massages, and unrelated to a specific condition. And so immediately we start thinking about, um, the massage therapists are being performed at the direction and based upon the decision making of the therapist, meaning they're choosing the technique, they're choosing the location, where they're going to work. The client wants, I want you to focus on my neck or my low back or whatever, and they're following that guidance. So, from a fundamental perspective, at this point, these are massages that should be billed out under the massage therapist. Now, you may remember the massage therapists don't have NPIs. That doesn't mean that they can't get them, but most likely, if the massage therapist were to bill the services out under their name and NPI, they would not uh, result in coverage. So, what they're looking for is to bring this doctor of chiropractic in as an independent contractor, and we're going to find out what they want this doctor to do. But fundamentally, they're looking for somebody to bill their services under. Okay, so the questions that the doctor has, if massage and chiropractic manipulation are seen as one and the same, then then what I'm understanding is either one or the other is to be used on a region or to only expect payment for one. It sounded like they should be done together as massage is seen as a preparation for the manipulation, yet if not done together, then to document why only massage was done. Okay, in this particular question, the doctor's kind of confusing. They are separate and distinct services without question, and they have separate and distinct codes. What the doctor's getting at, though, is that um, the recognition that there's some kind of bundling relationship between manipulation and massage, and there generally is. So, from for payers that incorporate the National Correct Coding Initiative, which is a reimbursement rule published by Medicare, there is in fact a bundling relationship between manipulation and massage. Um, Generally speaking, a lot of hyper technical arguments aside, if manipulation and massage are done in the same region, then the massage would be considered a component of the manipulation and not separately reimbursable. Um, so, to the extent, let's just say, for simplicity's sake, cervical, thoracic, lumbar region manipulation, that means all the muscles in the cervical, thoracic, and lumbar spine. If they were to receive massage, most payers would consider that massage a component of the manipulation, not separately compensable. The only way to get it paid would be to put a 59 modifier on the massage. But if you do that, it will get you paid separately, but you'll be paying that money back if the documentation demonstrates that massage was done in the same region as manipulation. So that's what the doctor's getting at with this question. And as a general rule, I would absolutely not recommend unbundling or separately reporting massage from the manipulation in that scenario, especially where you're a participating provider and the payer has a policy indicating that they either follow the NCCI edits or secondarily they have their own policy with respect to separate reimbursement for massage in addition to manipulation. If there is no policy, it's not technically wrong, but I guarantee you it is a coding uh, pair uh, that will get evaluated. And then you're going to run into the question to get the massage paid, you're going to have to bill it under the chiropractor who didn't perform the service. There is a rule that permits that in certain circumstances, and we'll talk about it in a second. There was no discussion about a chiropractor providing the referral, which I'm curious about. If I'm an independent contractor, can I simply provide a referral with a diagnosis to the facility, which has hired me as an IC, independent contractor? And if this is acceptable, would they simply have my name on the bill as the referring provider? Okay, now the chiropractor can, in fact, refer a patient for massage. And a massage therapist can exercise decision making and decide what to do and so forth. That service, as a referred service, however, cannot be billed under the chiropractor. And while the bill in Block 17, I believe, would refer to the chiropractor as the referring provider, the more relevant question is who is the rendering provider in Block 24J or K, depending on which version of the claim form you use, whose name is in Block 31. Now, if it's the massage therapist pursuant to a referral, that is correct billing. But like I said, it's very likely that the massage therapist, even if they got their own NPI numbers, that a payer would pay them directly. There are some plans I have seen in different states where a massage therapist can get paid directly, but they are few and far between. So, like I said, they're looking for um, uh, this doctor chiropractic looking to use that doctor's NPI number to submit these claims as if that provider either personally performed the service or provided direction and control supervision consistent with what's known as the incident to rule to allow billing under the chiropractor. But then of course there's a bundling problem. Now the issue with the incident to rule is that it requires the chiropractic physician to evaluate, diagnose, and specifically order the massage. That means, who to perform massage on, where to perform the massage, what technique to use, and how long. So the where is the specific muscles, the technique, if different techniques on different body parts, that's fine. But that all has to be specifically directed such that the massage therapist is exercising no decision making whatsoever. And even where the records support that, I've done a number of cases recently where payers can't get in their mind that they can't distinguish between a referral, where the massage therapist does the decision making, and a prescription where the chiropractic physician does the decision making, and the massage therapist is essentially not functioning as a licensed massage therapist. They become a chiropractic assistant at that point with specialized training in the performance of massage techniques. But nonetheless, payers are unwilling to recognize that distinction, even when the record justifies it. Unfortunately, most records are not that precise with respect to the order. So understand a referring provider. If you're referring a service saying, hey, go do massage on Sally Jones, then that service cannot be billed under you. Because you're not performing the decision making with it. All you're doing is passing the patient off to the licensed massage therapist. If you're ordering massage and you write a specific order, as long as the payer has adopted the incident to rule, which allows you to bill a service under your name and NPI that you did not perform personally, and it has a number of components. It's pretty much a 90-minute lecture. I don't want to get into details, but the fundamentals are what I pointed out. You examine, you diagnose, you write a very precise treatment order, and the massage therapist only does what you tell them to do. And if they believe that there's some reason to change that, they have to come to you and get you to write a new order. And then, and only then, and only if the payer adopts the incident to rule, can you bill that service under your name and NPI. But even if you do, if you've done a manipulation, then it's going to bundle anyway. So you're going to go through all that aggravation uh, for likely no separate reimbursement, which is why I roll back when we get to massage. Massage should always be cash in this scenario. Um, the last question is, my only concern is that they don't have an NPI at the center. I'm not sure if any of the massage therapists have an NPI number. I'll need to set up an appointment to discuss. So yes, the fact that they don't have NPI numbers, but understand they can get NPI numbers. The key is even if they had them and they bill under them, they're not going to get paid. So what this center is looking for, and understand this center is not a medical center, it's not owned by a chiropractor, it's not owned by a medical doctor, it's a bunch of massage therapists. Um, and it's basically a massage therapy clinic, and they want to bring a chiropractor in so that they can start billing third party insurance. It's a disaster waiting to happen. Now the good news is the chiropractor, as the um, uh, independent contractor, essentially, if this was done correctly, the center would have to get an organizational NPI, and then the chiropractor would have to associate his or her NPI with that organization. The organization would receive the payment. It's the organization that would have to sign a contract with the Blues and Aetna and Cigna if they were billing and network services, and it would be the center that would take the post payment hit. What I suspect is that they want to bill all this under the chiropractor. The chiropractor gets paid personally, and then what happens is if there's a post payment issue, it lands on the chiropractor, not the center. And so this is a disaster waiting to happen. There were some follow up questions with respect to referrals, and I think we addressed the difference between a referral and an order. But understand with massage, you need to be very, very cautious because usually there's not very many scenarios where it is separately reimbursable from a manipulation. Some people try to do the manipulation Monday, Wednesday, Friday, massage Tuesday, Thursday, Saturday. Understand that where you participate, a core element of the definition of medical necessity is that the care must be rendered in the most cost effective and least costly setting, and it's not cost effective to break up the visits like that. And there's usually no actual clinical rationale for doing it. The reason that you do it is because you want to get paid separately. Payers are very wise to that little billing scenario. They look for it. And it's very, very easy to smoke out with data analysis. So you don't want to do that. If you're billing manipulation, a CMT 98940 4142, in addition to 97124, the code for massage, or billing your massage as manual therapy 97140, either one, the massage or manual therapy with a 59 modifier, in addition to the CMT, also a very, very highly audited code pair. So if you really want to get a payer's attention, just do that somewhat routinely, and I can pretty much guarantee you you're going to get a record request and followed shortly thereafter by a refund demand. So I hope that, if you are out there and you're in the independent contractor realm, or even if you're in your own clinic, just be cautious about integrating massage therapy. Yes, patients love it. Yes, it's a can be a way to help people stay current with their treatment plan, but do not look at it from a third party reimbursement perspective as an extra service to get reimbursed for. You should keep it cash. If patients want it, they can get it. If they don't want to pay for it, then they don't get it. And for those of you that have a bunch of massage therapists, and all of a sudden you realize you're going to have to shut your massage therapy practice down from a third party billing perspective, and you're going to have a bunch of massage therapists sitting around twiddling their thumbs, teach them how to do resisted stretching exercises and things like that, where you don't run into the bundling issue with 97124 or 97140, but instead you're doing therapeutic exercises. Be precise as to sets, reps. You have to tell them exactly what to do, and then make sure that they're qualified, consistent with your licensure regulations to do that. Some states do not permit the delegation of therapeutic procedures. Some states don't make a call one way or the other. So check your licensure rules and see if that is an option for you. The great thing about massage therapists is they are familiar with the muscles, so they know which where their origins, insertions, and all that stuff are, and they usually can be taught some of these fundamental stretching techniques that are resisted, which is making makes them active instead of passive. Patients don't like it as much, but in the long run, I've had a number of clients say that it's actually better from a restorative perspective in terms of helping people regain their mobility quicker. So that is an option, but definitely check your carrier medical policies to look for bundling issues. Check your licensure rules to make sure that you can use them in that fashion, or any chiropractic assistant for that matter in that fashion. And but definitely avoid billing the CMT massage or CMT manual therapy code pairing, because it is death on a stick. I've been done dozens and dozens of those cases this year, and it's just unfortunate there where patients have certain plans, and yes, they have massage coverage, but when the payer sees it and pays it, it's billed out under you. Their expectation is that you personally did it, and they start doing the math in terms of how much massage you're billing out and how many hours there are in a day. Plus, they see it being billed in addition to manipulation, and they quickly figure out that there's no way possible that you're doing all this. And if they don't permit delegation, then um, then you may be looking at a refund demand. So that's all we have time for today. I hope that was helpful. And next time, hopefully, we'll be back in the office in a regular venue. But until next time, everybody stay safe and be compliant.